Okay, it looks like it's a little past the top of the hour. Thank you everyone for joining us today for this webinar. Bibiana, if you want to get started, go right ahead.
Thank you very much, Kim, and welcome and thank you everyone for joining this second webinar of the series organized by the European Milk Bank Association, EMBA. This series is organized with the support of Medela. Today's webinar will focus on how to protect breastfeeding and human milk donation in difficult times, lessons learned in Europe and Asia. Before we begin, I invite Natasha Jalou, Director of Medical Affairs Europe from Medela, for a short welcome message. Natasha.
Thank you, Bibiana. My name is Natasha Jalou. I am responsible for Medical Affairs Europe for Medela. And we are very happy to support EMBA in organizing webinars because our mission as a medical affairs team is really to support education of healthcare professionals, that is to say you, for supporting moms when they have lactation issues so that they can have a successful breastfeeding and that we achieve altogether a better nutrition with human milk of preterm and newborn infants. And we are, as you know, doing this support with products, but also with supporting research and also education. Just a few words about technique and housekeeping rules. At the end of every oral communication, you will have the possibility of asking questions. Please use for this the questions box, and Professor Beaucaire will pick up the question and the speaker will answer them. Maybe we won't have the time to answer all questions, but don't worry, we will forward those questions to the speakers and they will answer to you after this webinar per email. At the end, you can also download the certificate so that you can have a proof of the education you got today. And it would be very nice from you if you take a couple of minutes to answer a short survey, because we would like, of course, with EMBA together, improve the quality of our webinars. And we are really thankful for your suggestion and feedback. So I wish you a very nice moment and a good education with EMBA. Have a nice day.
Thank you, Natasha. I invite now Professor Claire-Yves Beaucaire to open the session.
Thank you very much, Bibiana. So welcome to everybody. Everybody here today knows that we have more and more humanitarian crisis due to climate change, due to for example, the COVID-19 pandemic, and also due to the war in the eastern part of Europe. And it's important to support breastfeeding and to support mothers who want to donate their milk. There is no rule at the present time for such a humanitarian crisis, but we have the possibility today to listen to three persons who are directly concerned by such a humanitarian crisis, and I think we can learn from their own experience. So I am very happy to introduce Professor Aleksandra Wesolowska. She is the president of the Human Milk Foundation in Warsaw, in Poland, and she's a member of the board of EMBA since 1909. And I also introduce Professor Agnieszka Krobak. She is a scientist, and she's also at the head of she's the head of the hospital in Wrocław in Poland. So Professor Wesolowska and Professor Krobak, you have 40 minutes for the two first talks to give us your own experience of such humanitarian crisis. Please.
Good morning, good evening, good afternoon, dependent of the time zone you are. Thank you so much, Clarice, for a kind introduction. And I am truly grateful for the opportunity to share our Polish, very recent and, to be honest, very tough experience arising from the Russian aggression to Ukraine and resulting refugee crisis. But before I start, I would like to disclose potential conflict of interest because I would like to admit that the Human Milk Bank Foundation, I am the president, was granted by Medela for the purpose of humanitarian for a humanitarian purpose. By the next 40 minutes, I try to answer the question in the title, what we really need to support the breastfeeding in emergency. As co-speaker of this talk will be Agnieszka Chrobak, as was mentioned before. Next slide, please. As you probably know, Poland is a country located in Central Europe, bordering with Ukraine, with a population of 37.5 million citizens and 331,000 baby born annually. 6% of them are born premature, and we have the network of Human Milk Bank. There is 16 units across the country, and all of them, most of them was established based on the government funds. And I am very proud to say that donor milk is reimbursed in Poland, but unfortunately only for a very narrow group of recipients, only for the preterms that was fed by tube. And next slide, please. I would like to say that breastfeeding rate in Poland is not optimal, but we are very happy that at the beginning the new mothers start to breastfeeding in a huge percentage because almost 97 newborns were breastfed, but unfortunately only 75 Polish newborn was exclusively breastfeeding. When you are looking at the numbers of 6 months of age of the baby, 38% of baby were breastfed, but unfortunately only 4 are exclusively breastfeeding. And it's a pity because the a baby-friendly hospital initiative has only been implemented in 25% of Polish hospitals. And it is the reason that 10 steps of successful breastfeeding has been linked to the organization standards for perinatal care, which is the legal act issued by Minister of Health in 2018. And these standards guarantees pregnant and postpartum women education and assistance is breastfeeding served by midwives that's working in the community. So based on these standards, every pregnant and in the postpartum time woman make possibility to have 3 times visit of midwives, including education in the scope of breastfeeding. But I would like to stress that lactation advice itself is not reimbursement by Polish National Health Fund. Next slide, please. Poland, like the rest of the world, has struggled with the negative effects of pandemic on breastfeeding. especially since the restriction on breastfeeding in Poland were very long-lasting and very safe. Based on the survey conducted among 10,000 women, we learned that although the practice supporting breastfeeding, like skin-to-skin contact, rooming in, directly putting baby to the breast, was banned in Poland for a very long time during the pandemic. The percentage of women who rate that support of breastfeeding in pandemic was very well has increased when we compare with a result of the previous year. But it's worth to indicate that still about 1/4 of responders reported that they did not receive the support that they needed to breastfeed their baby. So it is the landscape of the support of breastfeeding in Poland after the pandemic. Next slide, please. But I have to say that the scale of needs related to refugee crisis after the Russian aggression was truly enormous. In 3 months to Poland, over 3.6 million refugees came from Ukraine, which makes my country the leading country of arrival for refugees from Ukraine, and now the second country after the Turkey, which hosts the largest refugee population in the world. Next slide, please. And it's worth to add, worth to stress that the majority of them were women, also in childbearing age, and infant and young child, who constitute 3% of this group. When we are looking in the details to the numbers, more than 100,000 children were below 3 years old, and about 500,000 women are on the reproductive age. Next slide, please. What we knew about this population in the context of breastfeeding. As you can see, the child, the Ukrainian child ever breastfed, is the percentage of them is relatively high, because it is 95%. But when we are looking at the early initiation of breastfeeding within 1 hour, it is only the 65%. And when we are looking at the children under the 6 months exclusively breastfeeding, it is about 20%. Next slide, please. We also have a lesson from a previous military conflicts from Ukraine, which pointed out that the main problem that we can face will be untargeted distribution of breast milk substitute, especially by local and small NGOs and volunteer organizations. Also providing breast milk substitutes, water, and early complementary food for children under the 6 months of age. That means that probably there were widespread violation of double age code. Also, there is some socio-cultural context that we need to recognize, because in some part of the Ukrainian population, especially the rich part of the population, breastfeeding is seen as a solution for a poor people, from those who can't afford to buy formula. Also, there is some obstacle, because the most popular reason for cessation breastfeeding during the military aggression is believed that milk disappeared under the stress. And also, there is a lack of understanding the importance of infant, young child feeding in emergency, That means that the nutrition is not considered as a priority in such critical situation like a military aggression. Next slide, please. However, this data is not enough for us to recognize how we cope with this situation. So I am very happy and I am very grateful to cooperate with the Family Health International and to do the project inspired by Alessandro Almelo to assess the barriers to breastfeeding among refugee women from Ukraine residing in Poland. Next slide, please. The aim of the project was to provide up-to-date data on breastfeeding practice among Ukrainian refugee women, also to evaluate the perception and attitudes of Ukrainian breastfeeding mothers toward breastfeeding depending on the age of the child, and also to identify social cultural factors that may influence on choosing breastfeeding as a way of the feeding baby. We did a qualitative study conducted using the interview techniques. The sample group was 30 refugee mothers residing in Poland with a child to 12 months of age. Next slide, please. And we did the interview by asking the question about migration, about influence of war on strategy, on choose the strategy of feeding. We're asking about the feeding plans, about source of support, and I would like to say that. Please believe me that it was one of the most difficult studies I have ever conducted because respondents had to back to their memories to the moment of escape, to the moment of giving birth in that crisis. And I need to say that this project would not have been carried out without involvement and devotion of wonderful Ukrainian team, of the member of our project team, including two fantastic lactation consultants about whom I will tell you later more. Next slide, please. And the final result is coming, but the main problems we recognize also based on this study is the easy available formula and very hard to reach lactation advice and infant and young child feeding in emergency counseling. Also, the problem was the overlapping effect of the war trauma on other perinatal crises in Ukrainian mothers. And also, I have to say that language and cultural barriers between us is still some of the obstacles. Next slide, please. How we cope with this situation in the context of lactation support? I would like to say that the ad hoc action taken by citizens of Poland made it possible for the refugee and their newborn to survive here and now. However, we are not able to avoid a lot of mistakes in the context of lactation support. And two more often mistakes, even in my opinion, harmful practice, was organizing the fundraising to buy formula, even by the health professional organization. And another unacceptable thing was to donating used breast pump or breast pump not for renting. It was the personal breast pump, and there is thousands of advertising in the social media about this topic, and the worst thing is the reach and impact of this action was great because it was made by social media. Next slide, please. Of course, there were also organizations offered humanitarian help by more regular and more standard way, took into account protection and promotion breastfeeding. And I give you two of the examples. One of them is the action taken by Polish Association of Lactation Consultants, who provides free lactation advice to Ukrainian mother, and another is a distribution of leaflets made by my foundation in Ukrainian language. And we use the network of hospitals where there is the human milk bank to provide these materials for the mothers. But the problem was that this support was getting lost in the scale of the needs. And it was my perspective is that it is not enough. It was not very easy to access for Ukrainian mothers. Next slide, please. Also, I would like to stress that. It is amazing that around 77% of Poles were involved in helping refugees from Ukraine. It is the solid data from the survey, and as you can see, in all of the country, there is the family that hosted another family, probably with small children and newborns, but from my perspective, it was some of the barrier because there were no refugee camps in Poland. There is no place when this population is together, and for what the access to provide the help from my side, it is also very difficult, because this population was spread out between 1,000 of the Polish families. Next slide, please. So the action that has been taken is rather to provide a special focus on the new mothers who gave birth to their children in the active phase of the conflict, and also to provide clear and very context-specific and evidence-based communication on infant and young child feeding in emergency. Next slide, please. So when we are looking at the number of Ukrainian newborn, we collect the data from the national health system. And we recognize that from the beginning of war, by the end of April, more than 2,000 babies were delivered in Polish hospital in more than 200 Polish units. And I would like to say that all refugees from Ukraine were guaranteed legal stay, access to employment, education, healthcare, and other benefits, including full package of free and sexual reproductive health. And as you can notice, of course, there is a huge number of babies delivered in Mazovia region near the capital city where the Warsaw is located. But there is also another big city in Poland that the population of newborn is relatively high. Poznań, Wrocław, Krakow, Rzeszów. And it was those cities that we decided to provide our focus health. Next slide, please. So therefore, we are very happy and very grateful to join the campaign to help Ukrainian women in the perinatal period organized by Medela by organize a perinatal counseling point in a big city of Poland with special emphasis of lactation counseling by hearing the qualified medical personnel of Ukrainian origin. And also another task was the distribution of Ukrainian language version of the leaflet and information materials for mothers, and provide lactation equipment as breast pump if it will be such a need. Next slide, please. And I am very happy and very grateful to start cooperate with fantastic Ukrainian specialists. And I would like to tell you about two wonderful women. One of them is Olga Stetsiuk, who is the only one Ukrainian person that was certified in Poland as a certified lactation consultant. It's extraordinary solution because in Poland there is no possibility to be a lactation consultant without medical background. And Olga, from her education, is geographer and biology teacher, but she was working as a lactation consultant in Kiev. When she came from Vinica to Poland in 2014, in order to continue her passion and job as a lactation consultant, she needs to complete her nursing study in Kielce and take an additional course to become certified lactation consultant. Now she's working on Ujaztek Hospital in Krakow. As you maybe remember, it is the city where the population of Ukrainian newborn is high. And she's also the coordinator of Humanitarian Center of Perinatal Health in Krakow. And because she spent a few years in Poland, and she speaks fluently Polish and Ukrainian, of course, she also serves as a translator for us. Olga is working in Human Milk Bank Foundation since May, and she officially did 150 visits. But to be honest, I can admit that without her support, nothing happened in context of lactation support of Ukrainian refugees in Poland. Next slide, please. Another wonderful woman that I am proud to work with her is Yulia Alexandrova. She is the psychologist, focus on the perinatal time, psychologist in a perinatal care. She is the coordinator and social media administration of Early Birth. It is the NGO organization for parents of preterm baby. She is also a lactation consultant, working in a previous working in perinatal center is in Kiev, where is the only one milk bank in Ukraine. And Julia came to Poland in March 2022 as a war refugee with her two small sons. And during her stay in Poland, she adopted another child, a girl, who is the daughter of her friend, who has a duty as a Polish woman to stay in Ukraine during the Russian aggression. So Julia, from since May, Julia is working in Falkowicza Hospital, and for a moment you can possibly to recognize how her work is look like from the point of view of management of the hospital. But I would like to say that Julia officially did 140 visits during our cooperation, but she's the only one such qualified psychologist in Poland. Unfortunately, in Poland, we have no such qualified and focus on this aspect of the problem of perinatal period women. So now I would like to ask Agnieszka to give you another part of the same story. Please, Agnieszka.
Hello, everybody. Thank you, Alexandra. I would like to introduce our hospital, and it's my pleasure to work with Alexandra Wesołowska and also with Julia Alexandrova from Kiev, who is a refugee from Ukraine. So first, I would like to introduce our hospital, Falkiewicza Hospital in Wrocław. This is the biggest department of gynecology and obstetrics in the Lower Silesia in Poland. There is a special neonatal intensive care unit in our hospital, and a part of gynecology and obstetrics and neonatology. We also have in our hospital pediatric and geriatric departments. So in our hospital work about 500 workers, and about 400 medical staff. Yes. Next slide, please. So at the beginning of the war, at once we decided to help Ukrainian women. So at once we made a post to welcome these women, and in first 2 weeks we had 10 children. So 10 children from Ukraine were born, 5 girls and 5 boys. So from the workers of the hospitals and donor raised money to buy birth packages for Ukrainian mothers. Of course, a care and a childbirth was for free. And a part of that, lactation consultations also was for free. So we midwives organized to come to the houses of these mothers and to give them lactation advices. Next slide, please. If we want to talk about lactation and high level of breastfeeding, the quality of the delivery is very important for lactation. Here, at the same time, when Ukrainian war was started, in our hospital we started a transformation from normal hospital to the model center of reproductive health. So for us, it is very important to change and to have very high quality of the delivery. So we started to do it in the November of 2021, And you can see that we have lower percentage of cesarean section. So it was in 2022 more than 50%. Now we have less than 40%. It's exactly 37% of cesarean section. Additionally, there is a very low percentage of episiotomy, from about 50 to less than 20. And you can see also that there is the mother who come to us. Women want to birth with us. So in a half of the year, we have the same number of the birth like it was in all year of 2021. Next slide, please. So in the area of lactation, you can see that in last year, there were no donor milk bottles, but in this year we have about 200 bottles. We use it for our preterm children, and at the same time we have lower number of formula bottles. So what we did for changing the quality of lactation. So we cooperate with Milk Bank Foundation and general with Milk Bank. So additionally, we bought breast pumps because there were only two for our hospital. Additionally, we started to lactation advices for our patients. And at the beginning, it was 8 hours a day, 6 days a week. But now, from September, October, we started to make it 12 hours a day, 7 days a week. Next slide. So Ukrainian women who came to us, they burn 38 newborns, but additionally, we also have women after miscarriages. This is very high group of women. Additionally, there are a lot of small patients in pediatric patients. There, for example, about 60 patients below first year old, and there is also lactation advices for this woman. Next slide. Yulia Alexandrova, who came to us in April, at the beginning of her work, she couldn't work for us in formula in this area of law. Yes, there was no formal opportunity to work as a psychologist in Poland. She could be a volunteer, but she couldn't work as a psychologist. There was also a language barrier because Yulia speaks Russian and Ukrainian. She doesn't speak English and Polish. And that's why she could work and she can work with Ukrainian women. Additionally, no possibility complete the medical records in the hospital. As we know, in hospital we work together in the group. So if somebody completes medical records, another doctors look at this and decide next steps of treatment. So in this situation, we translate, we help Julia and translate from Ukrainian to Polish language this documentation. For Julia, there is also a problem of high costs of living, because Ukraine, in Ukraine, living is cheaper than in Poland. Additionally, for her, there is also a problem to a lack of support in caring her children, because sometimes it was the problem to stay with children or come to the hospital, and because she's alone here in Poland. But in June in 2022, so a few months ago, Medela, through Human Milk Bank Foundation, finances her work. And in this way, it was possible to help Julia and to help Ukrainian women in our hospital. Julia works with us and with patients twice a week. And from August, she also can be our worker of the hospital, because the law is changing in Poland in this area. So Julia makes lactation consultation for Ukrainian mother of healthy children, but also ill children, and of course preterm birth children. Additionally, she is very important, and her advice are very important also for Ukrainian pregnant women or women after miscarriages. And of course, she is also in contact with mother of preterm birth children. Julia works twice a week. She is in the hospital, but she makes a lot of consultation and care about our patients also online. And this is very important for them. Additionally, for Julia, Medela gave a lot of equipment to help Ukrainian women for breastfeeding. So thank you very much. Julia, in this time, she made more about 130 consultation, and because of Julia work, our patient from Ukraine could be more happy than without our Julia. Additionally, in our hospital, Ukrainian women have 1 or 2 rooms, especially only for them, because they care to each other and to be in contact, start to be friends. So it is very important to make these rooms. Thank you very much.
Thank you, Agnieszka. I am very happy and very proud to have a chance to cooperate with you, and thank you for your openness and readiness to eliminate the barrier together. Next slide, please. We are talking a lot about the barriers, but closing to the end of our presentation, we would like to share with you also the breastfeeding support success story. It is the story about Eugenia and her twins. The war found Eugenia in 40 weeks of pregnant in Chernigov, and she spent 3 weeks with her 7-year-old daughter and her mother in the basement without water, bed, and light. Then she evacuated to Kiev, from there to Lviv by train, and next to Krakow by bus. She spent 7 days on that journey. And after that, her baby were born prematurely at 26 weeks, but already safely in Poland and Ujazd Hospital. The 2 little sons, both of them under the 900 gram, were fighting for life in the NICU. And their mother was supported by Olga, that I was talking about her work before. Of course, many questions, many tears, a lot of grief, and huge fear. But from the first drop of colostrum, throughout thousands of hours spending with the breast pump, thousands of kilometers with bottles to the hospital and out to the house that it is located not in the same city that there is the hospital, but finally after the 4 months this child being discharged from the hospital as a breastfeeding twin. And for me, it is true miracle. And I would like to share with you by the end of this presentation. But going to the conclusion, next slide, please. Coming back to the question, what we need to support breastfeeding in emergency, I would like to say that for sure we need some of the resources. I am very convinced that we need highly qualified specialists, and the best practice is to engage the specialists from the same origin that the people that we are served our support. For sure, we need the legal framework. And as Agnieszka said before, for sure we need the management for crisis time. But from my perspective, we have also have a very realistic expectation and be goal-oriented. And maybe it sounds as a paradox, but I am convinced that we need to be prepared to the emergency. And I would like to say that unfortunately so far in Poland there is no implementation of national policy of infant and young child feeding in emergency. But the huge lesson learned for my country is to start to work on it. And I am very happy to share with you the news. It is the news from the beginning of October that our Ministry of Health just agreed, the group of experts I have proud to be a leader, to establish a Polish strategy for feeding children in the crisis situation. So please, finger crossed, because it is a huge job to do. And next slide, please. Yes, if I may, to also to thank all of the people that support me from the beginning of this unexpected situation, emergency situation in our friends in Ukraine. And I need to say that I am very grateful to my colleagues from European Milk Association, to support me in the time that I am powerless at the beginning. So thank you for all of the support with assembling the delivery kits, to sending them to Ukraine, with covering the cost of attendance of our colleagues from Ukraine to our annual meeting. Also, I am very grateful from my new friends for humanitarian organizations like Alessandro that I mentioned before, to conduct this research. And also you can see the Ukrainian officer, these two elegant men with the leaflet about the support of breastfeeding, because thanks to our diplomatic Ukraine-Polish cooperation, we also try to support the women in Ukraine. So thank you so much for your support, and thank you for your attendance to this meeting today. Thank you.
Thank you very much, Professor Wesolowska and Professor Krobak. It's very impressive to see how Polish population welcome all these Ukrainian refugees, and especially these mothers and their child. We hope that this war will stop as soon as possible, but yeah, it's very impressive. I have one or two questions. There is one question from Tanya Cassidy, and she asked, she would like to know more about the kinds of supports provided to the large number of women who had perinatal losses. Could you please answer to this question?
I think it's a question for you.
Yes. So at the beginning, this woman didn't want the help, but Julia decided to give them her phone number, and after, I know, a few days or few weeks, they started to take a contact with Julia, and in this way she can help them, and it was the style of psychological caring. Yes, so they contact with them, they talked to them, and she could also meet with them in our hospital. So it was this kind of help. I don't know, this answer is okay for...
I think so, yeah. There is another, it's more a comment than a question. So thank you for the beautiful presentation showing the heart of Poland. Congratulations on the transformation of hospital care towards less medicated birth and more lactation care to patients. And there is a question: how did you measure the hours, days? Can you explain to us? It's from Lendi Leitstein. Do you understand the question?
No, could you repeat?
It's
in
about
the area of lactation, we every time we measure it. So women from our hospital, when they go to the back to the home, in our hospital, almost every woman breastfeeding. Yeah, but we don't have results in long time. Yes, not yet. It's not yet in the area of lactation.
Okay.
if I may add one comment to the first question about support the mother after the loss after the loss of the baby. I was concerned, and I was a lot of doubts at the beginning when I proposed to work of the people that is also refugee to do the professional work in the hospital, because I was thinking about the responsibility to the patient, because I was afraid that because of the very difficult situation of Julia or other person in such situation, maybe it is not very responsible to provide such help in this situation. But I recognize that for most of the women, the most important was at the beginning to share the experience, to be together, even to cry together, and to be together in this very such difficult situation. So the professional help it's a next step, but at the beginning, the most important is to be together with the person that have the same experience. And I think that it is also very important in the solution that Agnieszka was talking about, that the women in Ukraine share the rooms in the hospital to be together, to be in the network, because it is also something that we recognize when we are coming to the reception point. That it is, as I said before, it is amazing that Polish people was very open and open the house for this refugee. But sometimes it is important to be together in the group of the people that share the same very, very traumatic experience. So it is, you know, it is the second end on the same line, in fact. Okay, thank you.
Thank you, Alexandra. Maybe there is another question. No, I think it's the last question. There was another comment from Anthony Newman. Great webinar and very touching stories. Thank you for sharing. Dan, I agree completely with this comment. Thank you very much, Alexandra and Agnieszka, for sharing these stories and how you welcome all these refugees. There is no other question, I think. Maybe I can ask a question. If Alexandra, you would like to give an advice, one advice, so a very short question for a very short answer. If you have to give an advice, if such a worst situation could occur in another part of the world, what is your main take-home message?
My main message is to implement the strategy for young child and infant nutrition in the emergency, to adopt the strategy, to adjust to our reality, because for sure it needs to be adjusted to the Europe context, but it is working. It is working, and it make when this strategy will be adapted, it make awareness of the policymaker, of our government, that nutrition it is also very important issue in the emergency, because the main obstacle that we recognize, that, as I said before, nutrition is not considered as an important issue in such situation, because there is plenty source of the nutrition in such situation, but this nutrition is not optimal. It is something that make children not to be hungry, and of course it is very important, but it is not optimal nutrition. So
Okay.
it is my main message.
Thank you very much. It was very interesting. I think we can learn a lot from your experience. Thank you very much.
Yeah. Thank you very much.
I think okay. So we move from Poland to the Philippines, and I'm very happy to welcome Professor Estrella Olonan-Juzi. She's a pediatrician in Manila, in Philippines. So she works in the Department of Pediatrics in the public hospital in Manila. And so please, Professor Olonan-Juzi.
Good day. I am Dr. Star Olanan-Juzi, as introduced, from the Philippines. First, I would like to thank the organizer of this EMBA webinar for this opportunity to share this presentation, Breastfeeding Protection and the Role of Human Milk Bank in Emergency and the Lessons Learned from the Philippines. So I don't have.
Doctor, if I may say, if you take your mouse and do a circle on your screen and click, you should have the ability to control the screen.
Okay, not yet, it's not moving. Can I have the control of the mouse?
You should have it. Circle on your screen with your mouse and click. Nothing?
Nothing.
Bibiana, you might want to take that control back and advance for the doctor.
Okay, there you go. Okay, so to continue, for my disclosure, I have nothing to disclose related to this talk. Oh. So the Philippines are situated as one of the world's most disaster-prone countries. We experience earthquakes, volcanic eruptions, typhoons, flooding, landslide, and even man-made disaster, and more so, the pandemic. During these difficult times, infants and neonates are the most vulnerable ones. For some babies, they may not be able to breastfeed from their own mother due to separation, and the best option is donor human milk. And we believe that breastfeeding is life-saving. So this is the outline of my presentation. I will give you a brief background of the breastfeeding situation, the laws protecting breastfeeding, the role of human milk bank in emergencies, and of course, the lessons we learned from this difficult situation. So globally, breastfeeding is considered as the best source of nutrition of infants, as it can reduce child mortality and child malnutrition because it is the ideal nutrition for critically ill and premature infants in the NICU. It lowers the rate of infection-related deaths. It prevents the development of enterocolitis and promotes faster growth rate, among other benefits of breastfeeding. Exclusive breastfeeding is the start of optimum nutrition among infants and young children, which includes early initiation of breastfeeding, exclusive breastfeeding for the first 6 months, and continued breastfeeding for at least 2 years with appropriate complementary foods. So now we look at the breastfeeding situation. According to the National Nutrition Survey done in 2019, the breastfeeding rate, the initiation or early breastfeeding initiation rate is at 74%, while the rate of exclusive breastfeeding is low at 35.9% with at an average of 4.4 months duration. So the Philippines as one of the signatories to the UN Convention of the Rights of Children, the Philippines is obliged to protect the right to good nutrition, including breastfeeding. And it should be accountable for both national and international levels as to the International Code of Marketing of Breast Milk Substitutes, which sets the standards for the marketing on the marketing and promotion, the World Health Assembly resolutions, the Baby Friendly Hospital Initiative, with the aim to give every baby the best start in life by creating a healthcare environment wherein breastfeeding is the norm. So it implements the 10 steps to successful breastfeeding, and the health facilities are certified as mother-baby friendly. And of course, the global strategy for infant and young child feeding, which provides governments and other stakeholders with strategies and components to improve IYCF practices. So to protect breastfeeding in our country, several legislations have been enacted by the Philippine Congress to support better nutrition. One, we have the Executive Number 51, or the Philippine Milk Code of 1986, and its implementing rules and regulations. It regulates the marketing of infant milk formula or other milk products, foods, and beverages, as well as bottles and teats. So that therefore, there are no donations of milk formula, feeding bottles, and teats that are allowed or accepted in time of emergencies. Next is the Republic Act 7600. This is the Rooming In and Breastfeeding Act of 1992, wherein the practice of placing the newborn in the same room as the mother right after delivery, that is to facilitate the mother and infant bonding and to initiate breastfeeding. And the infant may either be sharing with the mother's bed or placed in a crib beside the mother. On March 16, 2010, the Republic Act 10028, or the Expanded Breastfeeding Promotion Act, was signed into law, amending the Republic Act number 7600. So this is an act providing incentives to all governments and private health institutions, to all health institutions with rooming in and breastfeeding practices and for other purposes. So this act establishes standards for workplace, health facilities, and public places. We also have the Republic Act 11148. This is the Kalusugan at Nutrisyon ng Magnanay Act, or popularly known as the first 1,000 Days Law. So this law seeks to scale up the national and local health and nutrition programs through a strengthened integrated strategy for maternal, neonatal health, child health, and nutrition in the first 1,000 days of life. Then we have the Republic Act 11210, or the 105-day expanded maternity leave. So this act was signed into law by our former President Duterte in 2019, which extends the maternity leave from 60 days to 105 days. This law covers the female worker in the public and private sectors including those in the informal economy. And here, the mother can breastfeed her baby longer. We also have this Republic Act 10821, or the Children's Emergency Relief and Protection Act. So under this, it includes delivery of health, medical, and nutrition services. And under the program, the Department of Health, in coordination with the Department of Social Welfare Development, the local government units, and the civil society organizations in the community, shall provide the health, medical, nutritional needs of children in the areas declared as a state of calamity, including psychosocial interventions for children in different stages of development. So aside from those or these legislations, the government, under the leadership of the Department of Health, formulated policy and national action plan on IYCF, such as the revitalization of advocacy for breastfeeding, a training on breastfeeding counseling, the establishment of baby-friendly settings, celebration of National Breastfeeding Week in August. The Mother Baby Friendly Hospital Initiative was relaunched, and training on milk code monitoring. So this is the infant and young child feeding strategy, key intervention settings and services, wherein you will notice that the different laws were implemented to protect and support breastfeeding in any settings, such as the health facilities, family and the community, workplaces, industries, and schools, and including emergency. So while the Philippines often experience the occurrence of natural calamities, with the most common disasters as typhoon, fire, earthquakes, flooding, volcanic eruption, and the worst we have is, of course, globally, the pandemic. So these situations can threaten the nutrition and the health of the population, particularly the vulnerable infants, due to displacement of the people, separation of the mother and baby, loss of livelihood and income, and disruption of food supplies, and even a breakout of infectious diseases. So during emergency, wherein we know that disaster situations can also become an arena for donations of milk formula and milk-related products, the Department of Health, together with the WHO and UNICEF, call for the firm and continuous enforcement of these legislations, particularly the Philippine Milk Code in our country, which strictly regulates milk donation. And so pasteurized donor human milk from the different human milk banks are brought to the disaster area as for the infants who are victim of this disaster. Then all of those legislations, policies, and action plans should be enforced to protect mothers from marketing of breast milk substitutes that may undermine breastfeeding. Let us remember that breastfeeding and human milk feeding saves lives. So now, with this, we have recognized that human milk bank has a role in emergencies. So because human milk banks are established to provide safe donor human milk to infants in emergency situations, and it was proven to increase women's and communities' awareness on the importance of breastfeeding and subsequently improves breastfeeding practices and rates. And most of all, the provision of pasteurized donor human milk, which serves as a link to continue breastfeeding when both mother and baby are ready. Thus, we believe, or it is believed, that it protects, promote, and support breastfeeding because human milk bank or human milk banking is an essential component of breastfeeding. And we know that with the joint declaration or statement of WHO and UNICEF, human milk banks should be established or should be made available in appropriate situation. So in the Philippines, the establishment of human milk bank was also stated in the implementing rules and regulations of the Republic Act 10028, which was approved by the Department of Health on August 22, 2011, which explicitly encouraged the implementation of human milk banks and breast milk storage in all health institutions adopting rooming in and breastfeeding. So this has opened the door in the establishment of more milk banks in the country. So human milk banking started in 2008, or formally started in 2008 with the 3 pioneer human milk banks, and currently we already have 32 human milk banks that were established, and we have also established a human milk bank association in the country. So from then on, the Department of Health also gathered the local experts with experience in human milk banking in the country and formed the Philippine Committee on Human Milk Banking to provide technical experts in the development of the Manual of Operation. So this Manual of Operations provide guidance in the management and operation of a human milk bank to ensure that every Filipino child is not deprived of the optimum nutrition, health, and development during the critical years of their lives. So, what have we learned from this? With this, we have learned that, these are our realizations, that the local governments, hospital staff were encouraged to establish more human milk banks. And this is the geographical location of our human milk banks in the country, wherein majority of them are located in the National Capital Region, but we have already human milk banks that were established in the other regions. So another realization is that we have to continue during emergency, is that we have to continue to protect, promote, and support breastfeeding by providing breastfeeding counseling to mothers. And also to ensure readiness and preparedness of the human milk bank during emergency. So we know that disasters comes in time that we do not expect it. So we have to allot. So we have a 10%, we allot the 10% of the pasteurized donor human milk for every pasteurization is allotted for emergency. So this is a way of saving human milk or pasteurized donor human milk so that it is ready anytime it is needed. Then we have realized also that in responding to emergency, we have to have a proper coordination with the infant and young child feeding team in the area, because it is very important to discuss among them where if there is a facility or a refrigerator freezer wherein we can have the donor human milk to store while waiting for the time that it will be given to infants. Of course, the transportation and the handling of it and the distribution of the pasteurized donor human milk to infants in the evacuation areas. Of course, it should be given by a cup. Another lesson is that we have to capacitate the staff in the regions on human milk banking so that they know or they can follow the processes properly, and that is to safeguard the safety of human milk donation. So with that also, we have the Human Milk Bank Association of the Philippines released statements about the COVID-19 pandemic, and of course on the informal milk sharing, because during emergency, informal milk sharing can be rampant, and we know that it did not go through the process of screening of donors, and this may not be safe for the infants. And moreover is to establish networks or linkages. This is a simple demonstration of how other hospitals, communities, and the non-governmental organizations can support the human milk banks for the supply of breast milk. It is also very important that the hospital committee on human milk banks shall be able to prepare a plan for the networking, and then it is also wiser to look beyond the lactating or postpartum mothers inside the hospital to get more breast milk, so that we can have an adequate supply of the donor human milk. And in planning also, it is best to involve the local chief executives, the local government units in health and other surrounding hospitals, and maternity lying-in clinics, and the existing non-governmental organizations. And also the determination of the number of partners needed and shall be guided by the demand of the supplied by the human milk bank. So having presented all of this, I want to end my presentation that breastfeeding and human milk banking is a proven primary prevention strategy in building a foundation for lifelong health and wellness of our children. So in summary, the Philippines has passed key legislations on the protection, promotion, and support of breastfeeding and government policies aligned with the global strategy on infant and young child feeding. Human milk banks are established to protect, promote, and support breastfeeding, and we have to ensure the availability and mobilization of safe donor human milk donation during disaster or emergencies. Thank you very much.
Thank you very much, Dr. Olonanjuzi, for this very interesting talk and for having emphasized the role of human milk banks in such emergency situations. I think I have a few questions. Let me see. Excuse me. Excuse me, it's not so easy. I saw a question. I can ask a question. How is the donor milk transported from the human milk bank to the local point? Is it frozen? Is it how is it done?
Oh yeah, we transport the donor human milk to the area frozen, we pack it properly, and of course it is transported. It can be, if the area is far, by plane. We coordinate also with the airlines, and also in the picture you saw there on the military men, we also coordinate with the armed forces of the Philippines, because they have the plane. So we do coordination on how we can bring the donor human milk to the site.
Okay. I don't see any question. I think the question were for the first speakers.
I think Dr. Vesolovska has a question. Dr. Boken?
Okay, let's go.
Okay, may I ask, because I put in the chat box, but maybe it is lost. I have thank you so much for wonderful presentation. I have very practical question, because it is something that I have a problem in our reality in Poland. Is there any rules in the context of the order of recipients of donor milk in the time of the disaster? And another very, very practical question, who paid for it? It is kind of, donor milk, is your country, is it included in the cost of the feeding when the baby is the patient? And what happens in it is the baby from the community? Who pays for this donor milk?
So for the disaster, it's of course free, but the use of donor human milk from among babies who are in the hospitals, for our hospital, the use of the donor milk of the babies it's free. But for the babies coming from other hospitals, especially private hospitals, we do also collect a processing fee, but at a minimal cost. Yes.
Okay.
But for charity patients, it's free.
Okay, thank you.
I have another question from Tanya Cassidy. So she's wondering if there is any role for wet nursing in the Philippines.
Sorry, any rule?
For wet nursing in the Philippines.
Okay, so we do not encourage any more wet nursing. Before it was being done, but this time we do not encourage any more wet nursing.
Okay. I think I don't have any other question. Okay, I don't see any
Doctor,
other.
if I may say, may I vocalize one of the questions that I do see?
Yes,
if you don't mind. It says, your Executive Order 51 sounds a lot like the WHO code. How is it different? The WHO code?
It's basically similar, because the same. It regulates the marketing of breast milk substitutes in our country, and also the facilities also are not allowed to accept breast milk donations from the milk companies.
Thank you. One other question, and forgive me if this was already answered. Are there other countries that use donor milk for victims of disasters, or is this unique to the Philippines?
I think it's more in the Philippines, because as I have mentioned that we often experience disasters, and with the donor human milk, of course, since the donation of breast milk substitutes or milk formula is being banned, so we do really need to have an adequate supply and a ready supply of donor human milk for the disaster.
Perfect, thank you.
It doesn't look like there's any more questions that are coming through. So I believe we can end the webinar. Bibiana, if you have any other closing thoughts,
Yes,
go right ahead.
thank you, Kim. Dr. Bokiem would like to end the webinar.
Yes. Okay, thank you very much for the support of Maria, and want to thank very much the three speakers today. They brought very interesting experiences in such crisis, in such humanitarian crisis, and how to support breastfeeding, to support a donating mother, to support to help for the health of these babies. And I want really to thank all of them for their talks, and also to end this webinar. I would like to thank all my colleagues from EMBA, especially. You see on this slide all the EMBA board with Professor Sertaç Arslanoglu, who is now the ongoing president of EMBA. And maybe the last slide. So it's just a slide to save the date. The next upcoming webinar will be on November the 15th. It will be about new challenges for human milk and human milk banks, emergency and disasters. So it's a third webinar on this topic, and it will be moderated by Professor Sertaç Arslanoglu, the EMBA president. And you see on this slide the three speakers, Daniel Amouche, Professor Guillemot, and Mr. I don't see the name, Miguel Pipon.
Miguel Sáenz de Pipon.
Okay, and thank you very much for the organization of this webinar. Thank you for all the attendees for the questions, and it was very interesting. Thank you very much. Have a good evening. At least in France, it's evening.
Thank you, everyone.
Good
Okay.
evening.
Good evening. Bye-bye.
Good evening. Thank you.
Thank you. Bye-bye.
Do we stay for?